You guys can grip. Good morning. Oh yeah, can you? May not be a great model, but
Still looks too high.
let me see better.
There we go. Yeah, there's just a
Yeah.
delay.
Because I tried to show, but it didn't come out.
Yeah. I know it's good.
Hey, Amy.
Morning.
Okay. So we have Achilles tendon on the left side of the screen, lateral mal on the right side of the screen.
Can you flip over because
Sure.
that was the
Yeah, the convention previously was
Yeah.
mal on left side of the screen, tendon on the right side of the screen.
So we're gonna continue Sural nerve today and plantar nerve. Today is September 27th, Monday.
So on the left side of the screen we have peroneus longus and peroneus brevis.
So let me use the cursor. Okay, so here, peroneus longus, brevis, and you are looking for small saphenous or
Small.
vein.
Small saphenous vein.
Is right.
And you have to go to the sheet. Looks like this is small saphenous vein. And then go a little more. So we have to look for the hammock, right? You're already up. So now it's subcutaneously on the aponeurosis of the gastrocs. So are you in the,
Let me scan a little posteriorly to keep it in the center of the screen.
these are ones are just, they are running laterally and then goes to the middle.
I feel like we're making it out in the center left.
You see it? Can you go back and?
Right underneath there.
Here
Because
we
now
see
I feel like that small saphenous vein is compressible.
This one.
Yep.
Yeah.
This one, right? Then the nerve is here. And then this is the soleus. Canation, the nerve here, tibial nerve. So the Bianchi says the elevator technique, up and down, up and
Yeah.
down, up and down.
And I feel like that's right in the center right there, the hyperechoic. It's just for whatever reason
This
more
one.
difficult to make
This
out,
one.
yeah, on the linear
Yeah.
transducer. And yours stays fairly lateral.
So they said most of patients, distal 1/3, this is lateral.
That's right.
Then it goes to the middle. Abnormal. This one. This one. Here.
Now I feel like it's starting to go more posteriorly.
Yep. This, I feel that we are probably in my middle of the leg.
Yeah, and now we're in the gastroepineurosis. That makes
This
sense,
one.
right?
This one is
Underneath the
aponeurosis.
subq.
Can you make it a little, show this small saphenous vein?
Mm-hmm.
And let's start from here. I think somebody has to control my whole body's tweet. I'm gonna pin whole body pin.
Do we do the machine after?
Yeah.
Yeah.
I cannot. I'm a sick person. So when you do that, can you use, because Sural nerve we have to use high frequency one.
Yeah.
So let's use
Thank you.
artistic one. Actually, you guys can see large chat too, but I don't know, nobody is using it. More gel, be kind. That's all gel, I think.
Gel runway.
Yeah, gel runway.
We can do a standoff here. Take a look
Yep.
very, very gently. Okay, so we're
Oh, maybe.
Lateral mal on the left side of the screen.
Head off. Can I put your head up?
Achilles tendon on the right side of the screen.
Right, then you can watch.
Middle of the screen.
We're gonna adjust height a little bit so I can control.
So now I think I see it much more
Tell me
clearly. Right there.
This is my patient pills, that's it.
Better?
Okay. So now, cursor, this one.
Mm-hmm.
So my sural nerve is opposite. This is a small saphenous vein, right?
Yes.
So last week when we saw Jordan's,
Mhm.
small saphenous vein was here, and then sural nerve was in the next to the Achilles tendon.
Mm.
That's the most common need that happens. Most of people has sural nerve close to the Achilles tendon, but my case is very special. So this is the correct. Your left side is the
The left side of
Lateral.
the screen is lateral,
Lateral.
and the right side of the screen is posterior.
This is the Achilles tendon, right? Achilles
Mhm.
tendon, maybe Achilles. Can you go down a little bit? So God bless you.
Thank you.
I'm gonna change the gain a little bit. Okay, let's start from here. So
And now we're back at home.
now we are at the ankle. Here, lateral malleolus.
Yes.
This is the lateral malleolus.
Mm-hmm.
And then peroneal muscles must be longus brevis, is because it's the muscle
Close
is
to the
there.
Yep.
And then you move to more Achilles tendon. So here, let's find out the hammer. I can be. Still, yeah, my saphenous vein here, small saphenous vein looks like this one. Oh, I'm wrong
Right.
because it goes above the aponeurosis. So this is the nerve. This is the small saphenous vein.
Okay.
See here, there's another vein.
Yeah, it's a
here.
different fascial.
But this is the fascial plane is different. So this is the within the hammer. Can you find out the hammer? Maybe you can twist that a little bit.
Yeah, I'm trying to just a touch. Not quite the hammock that we had last week.
Maybe mine is a broken hammer. Used it too much. Okay, so this is the sural nerve.
There.
Right, like a tiny.
Yeah.
This my hammock is very thin and humble.
The small hammock.
Yeah, small hammock. So this is the sural nerve, right? And then Achilles tendon is here. Looks like small saphenous vein, this one. And then let's scroll up. And try to put in the middle. Here. Still lateral over my leg. Now in the subcutaneous. And here.
Flattening out
Now
a bit.
you are going to a little posteriorly, your probe, right? Is this the one? This one? Yeah,
Yeah.
this one. Still going. So why don't I go move a little bit up? Here, this one, this one. So stop there. Can you stop there?
Mm-hmm.
This is the sural nerve. And then if you guys see it, can you see it from the screen? We are in the
Yeah.
middle of the calf. But proximal 1/3 from the ankle, but the middle of the calf, right? That we didn't clear when we did the last week. Okay, go up continuously here, here, still here.
So now it's starting to track posteriorly.
Now you're in the posterior.
Right at the bottom of the gastroc, and it dives.
It's on the top of aponeurosis here. This is aponeurosis.
Yep, and I see it just to the left
This
of
one,
that.
right? So this is the sural nerve.
Mm-hmm.
Okay, go ahead. So I found that
We might have to switch transducers if it's that deep.
yeah, it's getting deeper. We are changing the transducer. And then I think between when we go to the gastroc 2 head, you can see in the middle. You remember when we did the Jordan
Mhm.
last week? The medial gastric, lateral gastric meets, that in the middle,
It's right there.
there was a sural nerve but splitting over there. Jordan's case, that's the most common you would see. Here, where is my sural nerve? So we're in the gastrocs, right? You have to find out the
See if I can follow up the
Yeah.
vein.
I think you have to kind of put more gel because when I take a look, like why don't we take a look at the muscle first? Follow the muscle and where the gastric start to come out. Still peroneus,
Mhm.
still so this is still. I want to make sure this is peroneal muscles. This is the soleus. Soleus. You go more middle, and then let's see when the gastric start to pop out. Yeah,
Right
gastric
now.
is popping out
Yeah.
now. So here, Sural, can you do lateral gastric, medial gastric? That's lateral gastric. So this must be the middle of the two head.
Progastroc, medial gastroc.
This is the soleus.
Yeah.
Yeah.
This is the flex hallucis longus here, because it's fibular. This is the soleus. Do you want me to turn on from position? I can't. Okay. Okay, still so let's go to the middle still. Oh, right. Now lateral gastric, you see it, right?
Mhm.
And then scroll up, move your probe to more medial side. You see two head. And then you guys can see by, where are you? Half of the calf, middle calf?
I'd say the approximal 1/3 of calf.
Oh, so you can imagine the gastric is so proximal muscle bulk, right? In the proximal, you have to really go to the proximal part to see the muscle bulk. Here you cannot see the sural nerve, right? You don't know which one is the sural nerve on this one. That's in the middle. From here, you're gonna track down to see where the sural nerve. Because in between two heads. That's not the one in the subcutaneous vein. Now soleus on aponeurosis. Can you find out where the sural nerve is from here? You have to go to the lateral side.
Not easy to find it from this approach.
Yeah. I think this is the way we can say that our home base is at the lateral malleolus, right? So let's start from
Sure.
the lateral malleolus. Ooh, who's gonna give me a massage? So start with here again. Okay. Where's the sural nerve?
I think it's the hyperechoic bundle right on the.
This one?
Yep.
Okay, go ahead. Still in the middle, right? Oh, can you, I lost
Right there. Did
this
it
one.
dive to the right or is it staying right there?
This one?
Mm-hmm.
Right, this one. After me, I think we should do Joe's leg.
Sure.
Yeah, because
And then right here,
Mm.
right. So right now we're starting to track more posteriorly, and I think we're starting to see the that lateral head of the gastroc.
This one is the lateral head of the gastro. Yep. This is also loose. This is the lateral gastro. So
Yeah.
now I have to move like this.
Tough to find up
You
here.
have to go to the medial side because you remember
Yeah, it's in
there was
between.
in between two, medial and lateral gastro. Oh, I'm disabled. Flex the hallucis one. Now you're gonna go back and forth over there.
Yeah.
Here, same things. We're here again.
I think we have to change the depth as we go because it's
Yeah.
too tough to see.
You have to do like this. Okay.
Yeah. So let's start over.
Start from here.
Lateral mal.
Let me
Achilles
just put
tendon.
more gel. Be kind to people. I don't know which people is watching, but okay. Here, can you just go back there? Here, initially it's hard to see which one is the nerve. Here, right? Which one is nerve here? You have to go a little proximally to identify.
I think I see it right
This one,
there.
This one. This one?
Yeah, pretty much right where the cursor is right now.
This one?
Because then you
this
had that one vessel that went below that fascial plane.
That's
with
the
it.
bit above
Yeah.
the facial plane, right? This one?
Yeah, but it's below the other one.
This one is the
Yep, so it's the second layer right there, and now I
this
think
one
Cyril's right next
and
to it.
this one together.
Yeah.
So my sural saphenous vein is the opposite side.
And easily compressible,
Yeah.
non-pulsatile.
Wow, it's so horrible sural nerve, right? But that's gonna be your patient, you know. Not the Jordan is gonna be your patient. Hagen Kim is gonna be your patient. This one. This one we are going to subcutaneous.
I think it's helpful too. One thing I'm noticing is it's easier to track with less transducer pressure because otherwise you collapse the vein and you kind of lose where it is.
Right. So you want to stay there and you change your probe.
Right here. You want me to change the probe?
Yeah, then you can see better, right?
Then we lose it again.
Yeah.
Why you lose it?
When we go more proximal. Because it goes deeper.
I see what you mean. Well, then you can use that one continuously. You want to toggle a little bit to show the. I mean, we know what is nerve, right? Because this is the nerve, but this nerve looks like it's so horrible. How we can use this nerve for the graft? See, as you go distally, that's the small saphenous vein and sural nerve will move together.
Yep,
But as you go up, they start to split a little bit.
that's right.
So here, this is the nerve.
Yep.
Okay. And nerve. 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 Am I in the right place? Nerve.
So,
And small saphenous vein is ran away from here?
yeah,
Wow. Sural nerve. Nerve. Yeah. Where are you? In the middle, right?
Yeah, I'm in the-
Probe is in the middle. Now gastro pops out. But look at this. This is the middle of two heads. So sural nerve is supposed to be around here. Maybe mine is splitting in two in the distal.
yeah,
Because according to Bianchi, mostly they start to merge very proximally.
mm-hmm.
But some people even merge at the ankle too. So my case must be distally, the merge is distally. So that's why I think you keep going to the, where were you, lateral side, right? But actually, when we look at Jordan's, it was in the middle. It goes in the middle and they start to split in the middle. Middle means like a, Yeah.
I
You wanna give-
actually have that article I want to bring up. Again.
You know about this one? I opened it up.
Yeah, Joe, you wanna be a model because someone who does exercise a lot, that person is nervous. But I feel good, but you can lay down.
Oh, okay. Okay, so I'll do it. Let me.
Yeah, I
get some
think you
shirts.
can be a model. Oh, you
Watch that.
Yeah.
shorts is here.
Oh, your shirt's there?
Yeah.
Good. I don't want to dirty your pants.
I know, that's why.
And let me get you a towel.
There's one.
Oh my goodness, look at this.
I
Yeah,
know,
well,
so
I took the. Yeah. But so, I'm not a good model. Yeah. So I was very competent to that big model. Oh, I have to let her softly. It was too loud.
Can you hold that?
Oh my god, my whole body is achy. I'm very sensitive person, so that's why I don't volunteer myself then. Morning massage.
Too late.
I know, but still I can use.
There's always more gel.
Yeah, always. Yeah, that's. I feel bad that I'm not a good model. But I think Joe is gonna be good because Joe has no fat. Look at that.
No,
Wow.
I've regained some fat because I decreased my exercise from 10 hours a week to 6 hours a week. So,
Only you do 6 hours a week?
yeah, it
I
used
thought
to be
you're
10.
6 hours a day.
Don't have the time as a resident. I would like to though.
That's good.
We might see like a traumatic hematoma around the he's
This ATFL is actually kind of always sprayed. The tendon doesn't look healthy. If you're curious.
Okay.
And I got a
Oh.
flexor tendon synovitis there. Let's see.
What's up? All right. Could you hand me the probe, please?
Yes.
Let's see if we can accomplish the whole thing with
I
the,
think we
with the
have to-
12
We have to master Plantar.
eventually.
Eventually. But Sural nerve is so interesting.
Yeah, it is interesting. Yeah, but
I mean,
we got
if-
massive plantar eventually
If
too.
we only study at the ankle level, it's easy.
Yeah,
But
yeah.
we want to track down. And then if you want to learn the blocking the Sural nerve, which is easy still.
Which transition around the 12? Okay, let's see.
Maybe I see my. Oh my neck. Moja. He has no fat. Moja. Chunk of gel at here, dimple.
Oh wow. That's
Yeah,
very
because
generous.
I mean, we have to. Oh, muscle looks better than mine.
I've been working on Dr. Kim. I do some my extrinsic and intrinsic ankle exercises.
Really?
I do.
Oh, you do?
I did.
Wow. Can you show the Achilles tendon better?
There we go. Let's get it all in it.
Okay, this is
This is home base.
so yeah, left side appearance brevis, and his saphenous vein, small saphenous vein is. Let's find out the Sural nerve. I have to go up a little bit to be clear. Everybody's different. I have to change the depth. We work on the depth here.
Now you wanted superficial?
Shallow, yeah. I think I see it right there.
You know this?
Yeah.
Can you change it to high frequency one? Yeah, that one. Yeah.
Alright, back to the hockey stick.
Change it again. B.
Is it
It says
B?
B.
Okay. Oh, I see. Is it the
Sural nerve is on the peroneal.
There we go.
See sural nerve over there. This is the cursor. The
Yep.
cursor. This is the sural nerve, right?
Oh, okay.
This one.
Oh, I see it. I see it.
How
It's
close
really
it is.
close to the vein on him.
Yeah. So he has the same order, like sural nerve and then small saphenous, and then Jordan's case is the opposite. See, very close your nerve and. So my point, this is a small saphenous vein.
Yeah.
Same facial plane, right? Here, yeah.
Yeah.
Yours are very close to each other,
Yeah.
moving together. Wow. Yeah, you going up?
Yeah.
And then can you make it deeper?
Yes.
Yeah. Now he's in the subcutaneous area. Don't press, don't press.
Yeah.
Sorry. I'm amazed at how big that vein is.
So big.
And now you're seeing a little separation because now Sural is breaking away from the vein.
A little bit.
Yeah.
A lot.
I can't even put them.
Yeah, together.
Yeah. So that's with the high frequency.
Now you're changing to the bigger one. The less frequency one. The
bigger,
linear
yeah.
one. Yeah.
Okay.
Change the vein.
Change.
Maybe a little less depth.
Yeah, it is so far. Is it from the, you have to come from the ankle again?
I see it right there.
So this?
Yeah.
Yep. And so we're at distal 1/3
So
of the ankle.
use your cursor so the people can watch.
So use the cursor, Joe.
Okay. Cursor.
Hit the arrow first and then move. Yeah.
Beautiful.
So on the arrow.
And we're still pretty superficial here, so you might even want less depth. Just look at how much. There it is, right there.
And that one. It's not looks two to me. 1, 2. See that two?
Two, is that the one move here?
Are you going up now? You're in the middle, right? Looks like it's
Almost
two.
there.
Yeah.
Yeah.
See, stay there. 1 and 2. 2 split it. 2 see? Here, oh here, 1, 2. 1, 2.
I see.
Do you see it?
Yeah.
It's
Yeah,
two.
one with down. One
Yeah,
with
it's
that.
2. So your case is what is the medial? This is more lateral gastro, and this is the medial gastro. And can you go up continuously up? Now one goes here, one goes over there. See now coming together, going down, right? See,
Mhm.
I saw 2. Now they're meeting over there. That's meeting over there, and then splitting. See, 1. Stay there. Stay there. 1 and 2. Look at very carefully these 2 things. Okay. Go. You tell us go down, go up. Now you're going.
Now we're going up.
Yeah. See, going up. Even though I didn't look at it because 2 different nerves running.
So,
So
this is
that-
somewhere around here.
There must be. This must be from the common peroneal one. Running this way is the from the tibial.
Yeah, that makes sense.
See, I still see it here.
Mhm.
Can you go down a little bit distally? Only we are seeing common peroneal branch. So now 2 things become 1. Here. Where are you? See, same place.
About halfway down the calf.
Yeah. So there are 2. Go down a little bit down. So now 1. Now 1. Very subtle. I think we saw same things with Jordan. I took a picture of that Jordan's nerve. It's a facial line. Now it's splitting two. I see two. 1, 2 on the right side.
Mhm.
And then go up. Can you follow the medial gastro part? That's, you're in the lateral gastro part,
Sure.
right? So somebody is telling us, maybe Jimpo.
No,
That's Elizabeth.
Elizabeth?
Yeah, Elizabeth just texted.
How continue?
It's not her. We just saw it on your computer.
I see all.
Oh, 7, sorry, we need
Scanning distally now to see them together. So right there, we're still as one, correct?
yeah.
I just see the one.
Yeah.
Over there, one because it's this stuff. You're about 2/3 from the knee. Now I think it's splitting.
You think
Over
right?
there, yeah, over
Yeah.
there.
That was
so
it, right there.
One, yeah. It's it's
Let's see if we can follow the medial branch.
yeah. Jordan's one was
I don't know that I could see it.
Yeah, I lost it at the split. It was,
yeah. Oh, let's go back to this. Oh yeah, because it's hiding here.
yeah, should be
Over
back
there,
there.
over there. But after that, I don't see it.
Let me decrease it that a little bit.
Looks like
So
only
scanning
missing
distally to see it
lateral.
together.
Here.
Okay,
Looks like
I see it
over there
together.
is two merging together. Can you go up and down over there?
Are you seeing them adjoin? Now going
Over
distal.
here, over
Here,
here, looks
here's
like
good.
see two?
I see.
Toggle a little bit. I see this is a 2. Where are you? See, this is about 1.
Oh, okay, I see this one right here. The second medial. Potentially the medial.
Right? That's 2.
You think it's that flat?
Ah, yeah, because it was
Maybe.
very flat.
And then let's see. Let's follow those bumps because that's right
Yeah.
there.
That one, let's follow that one.
Scanning proximally, scanning proximally.
Now it's in the middle. That's what we
Ah.
followed from
Alright, so
Jordan.
my medial Sural branches between the medial and lateral.
Perfect.
Gastro.
Perfect. Perfect. It's in that little row. right
Yeah,
there.
we had that one from Jordan.
Okay.
So that's the tibial branch.
Yep.
Tibial branch of the Sural nerve.
And let's see if we can follow.
Can you make
all
it
the way-
deeper? A little deeper. so we
Increase
can-
that? Okay.
So this is the head of the left side is the lateral head.
Lateral, gastroc, medial gastroc.
Right side is the
soleus.
medial and yeah, soleus, and in the middle is the tibial branch, and on the top of over there is the sural nerve in the left corner. Yeah, that one.
This one?
Underneath
Yep,
of the
that's right.
arrow, that's the lateral lateral cutaneous sural nerve.
Yep.
And then medial is over there. Whatever the approximate part or distal part, I don't know which one, but that was in the middle.
And so
Can you
now
tell?
let's see if we could track this to where it comes off of tibial.
Can you show me which one is the medial cutaneous sural nerve?
So we got up to here.
That one?
No, we got around here between the medial and lateral gastroc, and then I was trying to isolate it.
Right there.
Oh, that one,
Yep.
where the arrow is.
Yep.
Yep. So then let's follow that one. Looks like you remember it was diving down.
It looks like
And then
it's
we
going down.
disagree, and then Jim sent us text that this is the cutaneous nerve. But for it to meet tibial nerve, maybe it needs to come down.
So my debate is both inferior or superior.
You going up, I see it up. So I think the sumal saphenous vein going into the popliteal vein.
Yes. Let me straighten out the knee.
Yeah.
So you can
It's
see
really big.
more my vasculature. I think you had to go more medial.
Yep.
Alright, right there.
Okay, so just scanning distally to get a better picture here. Let's center in the
From
middle of the
here.
screen. Yeah.
From
So
here.
now we have both Surals.
Yeah, we have
Both
Sural.
contributions to the Sural.
Can we stop there, both Sural,
Yeah.
to show? Okay, just stay
Alright,
there.
so this is
I'm gonna freeze, so later I can make, can you make it a little better? Freeze.
lateral.
Is this better? So here, cursor. This is the
Lateral.
lateral. This is the medial, right?
Medial cutaneous branch of the sural nerve.
Yeah. Okay.
So let's go. Where did my first go? Alright, so go back to the medial cutaneous branch of the sural nerve. We're going more proximal.
Continuously.
What is that bundle over there to the left?
There's three things.
Here?
One, yeah.
Yeah. To the left in the musculature. Down, right there.
That's all the nerve. The
No.
tibial nerve to the gastrocs.
Okay.
Yeah.
So we should be able to see that join up with the Sural.
Yeah. No, it has to go really proximal over the, I think, knee joint area. Go continuously.
My guess is it's about to happen.
See, it's coming up.
And that's
Oh,
tibial.
there's a yeah,
Tibial
tibial
nerve.
nerve. Ta-da!
Yeah.
Then let's do
Massive
this.
tibial nerve.
Can you just toggle a little
Yeah, I'm
bit
gonna.
first?
I need a little more gel.
Okay, so here they're coming together. See, here this is the nerve, bundle of nerve, right?
Yep.
This is a nerve. They're meeting together. Move proximally. See, now become tibial nerve, big tibial nerve, and then this is the saphenous vein. No, popliteal artery. This is the posterior. This is popliteal artery become. And they change it to tibial artery. Oh, there's the nerve meets over there. So when I put the needle laterally, I have a lot of big, I found a big little point over there. See, two nerve, big bundle of nerve. Can you toggle a little bit for us to see the nerve, bunch of nerve fibers?
Yeah, right there.
And then, can you just stay there? Let me take a picture. Sometimes I feel really rather take a picture.
I get commission off this, right?
Of course. You're the
I have such nice
Two
nerves.
more. If you push the subscribe, then we're gonna have a dinner. We're going
Subscribe
out
and
for
bell
dinner.
icon.
I
Two
did.
more.
I hit subscribe.
Dr. Kim, as soon as we over 100.
Oh, we
Not
are.
yet.
Yeah. Nice.
It's 98. 98, right? Nobody's just Joe didn't help us, so we can have dinner. Oh my God, look at this, how great that is. It's you. It's Joe, I'm sorry. Wow, it looks really good.
I've been working on my nerves.
So that bundle right there is tibial in the pop fossa.
99.
99. You see? That's what.
Joe,
happens.
did you push?
If we get
No, I
to,
pushed it like a few weeks ago. So.
You have one.
I'm making faux YouTube accounts just to get the subscriber level.
See,
Oh,
Dummy accounts.
just by scanning
Gerard
my,
1, Gerard 2.
my tibial nerve, we got a night. Well, we got
So
one
this
light.
is the just above, right? Hold on a second. Then this is the sciatic nerve, tibial branches. We're gonna make it. Oh yeah. Sorry. See, sciatic nerve. So here, sciatic nerve is split. Can you see the splitting part? Sciatic nerve, make it deeper. Sciatic nerve.
Center of screen.
Okay. Sciatic nerve toggle a little bit to show better. So underneath of the biceps femoris, and then so stay there, and then here make it like this, hold it.
Yeah.
So here cursor. This is the semimembranosus, tendinosus, biceps femoris, and long head, short head.
That's right.
So did you
This is the
switch
like
your
the nerve is
orientation?
coming in.
No, orientation's the same.
Your left is medial now?
Yeah, medial. Oh,
Left.
it has not been changed.
Oh,
It's
good,
the
good. The
same
left should be
things.
medial
Yeah.
now. Okay, that makes sense. Good.
What can the student tell you?
No longer students. Oh, lifelong
Say
students.
like make sure.
Lifelong students.
I regret that we don't take a picture when we make the slides. So you can see the nerve coming in and out over here.
I want to see the division.
What division?
Oh, you mean between the
Common
sciatic and common peroneal?
Yeah.
Oh yeah, if you
You
scroll
can
down,
track it,
if
yeah.
you track
You
down,
had it. You actually had it.
Right there, right
yeah.
there, right
Now
there, right there.
splitting
Yeah.
from here. Two. So you scroll down from here. Splitting two. It's still sciatic nerve, right? Round, beautiful. Can you stay there?
Mhm.
Can you see two already here? Stay there. One and two. One and two. Okay, go ahead. Scroll down. Now splitting two clearly, right? Stay there. Okay, continue. One goes to the
Mhm.
fibular head here. Laterally you're moving.
Mhm. I see it right there, right above the fibular head now.
This is the nerve, this one.
Common
Okay.
fibular nerve.
Wrapping
remember
around the fibular head.
Wrapping around, and it goes to, it passes the hiatus between the fibular and tibia, and it becomes the peroneal nerve.
Mhm.
If it goes to the anterior part, and then above the fibula, it's in the superficial that becomes superficial peroneal nerve. So now you are, yeah, see here. Oh, good boy. That's the superficial peroneal going, and the where how can you find out the deep peroneal nerve? That is always moving next to anterior tibial artery, underneath of EHL. That's the deep peroneal nerve. See, if there is no junior, you can do whatever you want. So over there, look for the artery. Now it's coming to the go to front a little bit. Already you can see artery over there. There. Can you put the color flow?
Mm. Yeah, I see it.
Common
I see
Yeah.
the I see the blood already moving
CF.
around.
CF, okay.
Yep. Just push it up.
And
Okay.
move
Bring it
the
down
How-
with
how-
the ball.
ball, move the box to the more lateral. Over there next to underneath. So here already about 1/5 down from the knee, and then this is the anterior tibial artery, right? This one, and then this. Do you see this a little bit of a honeycomb shape? Now it's changed. Before you had it, so stay there. It's very hard to see because the nerve is moving away from the scanner. But this area is the deep peroneal nerve, and then above the EHL, EDL, peroneal muscles and anterior tibialis around here. This hazy part is the nerve. See a little bit? Colorful. Let's get rid of the colorful. And then
Tibial
one.
anterior, EHL, EDL.
yeah,
peroneus.
EDL is always above the EHL.
Okay.
EHL is above the anterior tibial artery and deep peroneal nerve. So deep peroneal nerve is hard to see because it's diving. Going up. Now you see the you have to go around underneath of the tibial head. Over there is coming. Over there is coming in. Yep. So you see where the
Yep.
hazy one. Yep, that one.
And I want to see where the lateral aspect of the sural nerve that comes off the fibular nerve, where it comes off. Yeah.
I think it's not gonna be easy. We have to go up and down a million times to see.
Okay.
Because- But it's superficial, so possibly we see. But I think we kind of saw it. You remember?
Mm-hmm.
Joe's lateral cutaneous sural nerve was
We saw it. We saw
Yeah.
it, but we didn't see the connection.
so you can follow that one continuously.
Yep.
Because why don't we go from here and then look at it? Okay. Maybe we get rid of the cursor.
So yours is still attached at this point, very, very close.
To the small saphenous vein.
Yeah.
Small saphenous vein for him. I don't know that's very small saphenous vein on the top that one. Because
It's
oh,
compressible.
because you're far. Oh, no. I'm sorry. I was I got confused because he is already sural nerve is already in the subcutaneous area. Where's the sural nerve? I cannot see that. The little teeny tiny one.
It's hard to say.
Can you go back? Because it's if you move fast. Oh, now
Now I
I
see
see
it.
it.
Could you adjust the depth,
underneath
Joe?
of the cursor,
Okay, yeah.
underneath of the yellow
Yeah.
one. Yeah. No, it's in the. It's
Is it this?
no, no.
No?
On the he's gonna move to the middle.
Yep. It dissociates from the smaller saphenous vein as you go more proximal.
Yeah, splitting.
Because you can see the veins now popping up over there, and now the nerve is much more in the midline.
Nerve in the middle. The lateral gastroc is coming out. It's on the top of the lateral gastroc, right? In the
Mhm.
middle. A little away. In the middle. That's the sural nerve, lateral cutaneous.
Okay.
And then it's gonna go. Let's see if that is meeting the common peroneal nerve. Oh, such a small nerve. Follow. Maybe in the middle. Good. Oh, put it in the middle. Okay. Put it in the middle.
Yep. It looks like it's coming off all the way to the pub fossa.
It's here.
Yep. Coming in
Yeah.
to meet the common pib.
Wow, it was meeting actually. You saw meeting, right?
Yep. More
Yeah.
depth, Joe?
Can you toggle so people can see? There are two nerve. Cursor. Can you go back? Here one. Stay there. One and two. Can you scroll down now? Let's follow this one. Follow this one. Follow this one. This one. Follow. So this must be becomes sural cutaneous nerve. This is the main one, common peroneal nerve. But one goes to must be sural. Looks like this. Ooh. It's not this one. This one. Come down continuously. Yeah, there's a runner, isn't it? Yeah, that one. Then disappeared. It's more difficult than last week.
We keep on finding new challenges every week that keep us on the nerve.
Yeah.
We have 10 minutes. Do we want to do a quick plantar introduction?
Yeah. We did the last week, but let's go.
What are you gonna do?
Quick plantar nerve.
Oh, fantastic.
Yeah.
That's I need to
Oh.
I have
do
not
that.
scanned it, so
Yeah,
I'd like
yeah.
to see.
Me too. I've been doing
You can
Sural, but it'll be good to see the plantar.
Yeah, you can twist it.
How would you like it?
Plantar is easier.
Easier?
Easier than sural.
Oh.
We didn't screw up
We
and
did a
down.
little bit.
Yeah,
we just saw it
didn't.
dive.
With Tom,
Yeah, I see the dive. That's
yeah,
usually where it's
Tom,
scanned
Dick,
to.
and Harry, we did it.
Yeah,
but we
Tom, Dick, and
didn't go
Harry.
to the
Tom, Dick, and
plantar.
very nervous, Harry.
Yeah.
Yes.
So you can lay down the way. Oh yeah. Now you can see it. You're gonna. You should do this one at the beach. You're naked, right?
This leg is Joseph's leg.
Don't
forget the video.
Make sure he will get the
Give me another 50 likes just for this leg here.
But I couldn't find any.
I think I see the scars from the shin kicks.
Yeah, I have a lot of scars. Yeah. Yeah, they're from the kids.
You have a scar.
Yeah, I have scars all the time because I kick a lot.
Oh. Calm down your ankle, you know.
Can you change transition?
Yep, changing to the 18.
Oh, they changed the game.
And your orientation for this one is you would like.
I think last time we put the malleolus on the left side of the screen.
Good. That's
Yeah,
where it is now.
see there. Posterior tibialis.
Yeah,
We see it.
posterior to-
And then,
So look at that nerve.
Yeah.
oh
That's
my
actually good.
god.
Oh yeah.
Oh yeah.
Okay.
And we can possibly see the splitting since his nerve is so good. Oh my. Splitting now. See, look. Did you see?
I can see.
Yeah. See now, it's just about split.
See if I use my left hand. That way I'm not blocking here.
Yeah. Splitted. So here, if we do, can you orient us here on the left side is the,
Posterior tibialis. And
this
that's
is
medium
the medial
malleolus.
malleolus, posterior tibialis,
Flexor
flexor
digitorum
digitorum longus, and then this is the posterior tibial nerve, posterior tibial artery, but about split. Can you move distally? Then this is the flexor retinaculum, right? This is the flexor retinaculum. It's covering here, and then you're gonna continue to go here. One.
So I see a nerve up there on the left.
Yeah,
One
but
One there.
one there has to be this one. This one. One, this one. This
So one dives deep.
One is medium, one is lateral. Let's follow this one. My name is so sleepy. This one.
She's a busy fellow, working hard.
She's coming far. Over there. Okay. I see another one.
Yep, get it. You only have so much space in that probe, so follow one.
So maybe you want to change it to the
Sure.
less one, so we can compare how it look like.
Going to need a lot of gel.
Are you going to sports fellowship?
Yeah, I'm interviewing right now.
Shiny, no wrinkle.
I like the ankle. Yeah. But I like that you focus on the neuroanatomy because that's something, less commonly scanned.
Yep.
Because I do all the muscles and ligaments.
So you want to
Nice.
come from the medial, and then you change it. I want you to change the angle to show difference. So let's orient first from the flexor retinaculum here. Okay, so now posterior tip, your posterior tip seems to be a little. Sometimes I see that the flexor digitorum longus has more fluid in it. Sometimes his case is looks like a little bit of a posterior tip has some fluid in it.
Yeah.
Right? One of my patients on Monday had a lot of
Yeah.
swelling. Compared to yours, he has more swelling in the posterior tibialis. He couldn't walk, so we gave the Camboot.
Ah.
Okay. So so if we do that here, this is the posterior tip, flexor
Yeah.
digitorum longus,
Yeah.
and then nerve is harder to
It's harder
see.
to see.
Wow, so the high frequency is so important. It's not easy.
Yeah, the hockey pro.
Yeah,
does
that's
a better
the
job.
17.
The hockey pro was the 18 and it's
Here,
better.
here.
Yep.
I see here.
So it's fine.
But still, wow. And then you want to scroll down to see how it's split. It's hard to see.
So
here.
now we have one that's
two,
deep.
one,
right?
and two.
Yeah.
Looks like this one. One and two. You want to follow this one?
Let's follow one. Follow one first. 'Cause that's
Wow,
more
it's
easy.
very hard to see.
It's very hard to see. What do you follow one first? One
I
looks a
am.
little easy.
Yep.
Oh, you are? Okay.
That looks like it's
That's
medial.
the media.
Wait, let's trace it. Good, good, good. It's a little harder to see.
Maybe he wants to change. It's between what? Hallux longus, flexor.
I see it right there in the
hallucis
middle of the screen
brevis.
right now.
Yeah.
And then it dives, and you can see you see the hyperechoic in there, but I think that's
Wow. That's the adductor hallucis on the top. Can you change it to hockey stick because it's not very clear. Once we learn, and then we can change the direction.
Switch that from.
Yep. So now we
The
have.
other direction. Right? That's the way you
So
did.
now the left side of the screen is towards the medial malleolus.
and the right side of the screen is posterior.
That's the good one.
So approximately
Yeah.
very easy to see.
Here, and then as you come down. That's interesting. Already split it?
Yeah, mine split.
I think I already split
Mine
it.
split it already. Yeah. Mine
So
splits
you
it
have to
already.
go up the ankle level more. I start from a little proximal part.
Yeah. This is when mine starts splitting.
Okay. So now here split it.
So now we have the tibial, still tibial at this point, right?
Still splitting, yeah. Now here splitting, see?
Yeah.
2, 1, 2. 1, 2. Yeah, pro. Okay, so which one you wanna follow?
Medial. This one.
You wanna follow this one?
Yeah, I'm following.
Let's follow this one. Just must be medial.
Yep, still kind of superficial. Yep.
Yep, keep following it.
Okay, follow that one.
Uh,
Oh,
disappears.
I think it's deep. Here.
Yeah, see, found it
See?
again.
It's deep.
Found
Here.
it again. And now you have to
Here.
increase the depth.
Wow. Where?
See it? I still see
Very
it.
deep.
Still see it.
Yeah.
But you see, I'm sliding down at an angle.
Mm-hmm. Oh, hold
Yeah.
on a second. So let me take a picture. This one, and then I'm gonna take a picture of this one. Okay. Still, can you toggle a little bit to show? This is the nerve, right? This.
Then we lose it right there,
There you got it.
which is not
This
far.
right here.
is,
Keep
yeah.
going. So
Oh, then
I lost
we
it.
kind of losing it.
Yeah.
You may
Oh,
pick it
this
up
one?
again right here because this is where the stem point is.
So that's medial plantar nerve. Nice.
The next week is plantar nerve, mastering the plantar nerve. We have to bring the anatomy. Go back. Back
What
here.
anatomy?
No, to show between which muscles is
Oh, yeah.
spreading out.
What are you going to use for look at that anatomy? Do you have a preferred resource for that?
Let's go to YouTube.
You
Google
do?
it, yeah.
Type in YouTube.
Google. Because that's the easy one to find out,
Yeah.
if we can find it. So I
Joe,
think-
thank you for donating your leg.
Yeah, thank you so much, everybody. We're
Amy,
gonna
thank you for letting me
stop.
scan.
Of course.
Hopefully.
And now we should be at
What do you
100
wanna-
likes after they saw my leg.
Okay, end the stream. and then we're gonna go this one.